Dr. Tom Roselle live right now on 105.9 FM and AM 630 WMAL.
Good afternoon. This is Dr. Tom live. Only this isn't Dr. Tom. This is Sue Roselle. And I'm sitting in for him this weekend while we are waiting for his return. And Dr. Leonard Poe is with me today as my guest to talk about problems that you may be having with your health, things that you may have tried to correct health problems or concerns that may not be working the way they should be, or you're on more medications and facing the possibility for surgeries and you'd like to see if there's something else that might work and might work even better. And that's what we're here for. See if we can fix this naturally through chiropractic, acupuncture, and nutrition. Call me today. 888-630-9625. That's 888-630-WMAL. And Dr. Poe, good afternoon.
Good afternoon.
How are you?
I'm doing well. How are you?
It's a great day to be outside.
It is. I can't wait to get back out there. Yeah.
Not in a dark studio. We're going to talk today a little bit about an epidemic that seems to be getting more and more popular press as well as in the peer-reviewed literature, and that is the gluten intolerance epidemic.
It's been it's been in the news a lot lately, actually.
It really has, and part of the reason is because they're beginning to see that what we've known about gluten intolerance up to now has been the tip of an iceberg.
Yeah, it's the what was thought to be the little boat now is actually being thought of now as the big boat.
Like the Titanic?
Yeah.
Gluten sensitivity used to be considered only a problem for people that had a very obscure genetic disorder called celiac sprue. Affects probably about 1 to 3% of the population that have the genetic weaknesses for that. What we're finding now, though, is the estimates, I believe, are now 1 in 100 people in this country have some degree of gluten sensitivity.
The thing about that is it's 50 years ago, it was 1 in 700.
Yes.
And now it's 1 in 100.
Now it's 1 in 100. And they consider that even a very marginal understanding, which means the better we get at testing for that, the more people we're going to find having a problem. So, Dr. Poe, tell me why that particular situation is such a problem. Why are so many people having difficulties with it, and what happens?
This is really a large topic to discuss because there's lots of different pieces. The thing about that statistic where 50 years ago it was 1 in 700, now it's 1 in 100, that's not a matter of just we're testing for it more, and that's an important piece for folks to realize. It actually has increased. The way they went about and got that statistic was based off of frozen blood studies that they did, where they took, I believe it was from an Air Force base, but they took a bunch of frozen blood, or they took a bunch of blood from all the airmen and their families and froze it and put it away, and recently they brought it back out and they unfroze it and they looked at things, took a similar cohort of the same kind of, general population and ages and everything here now, and then compared them. Just across the board, what changes did they see? And that's one of the big changes that they saw. So it's not just that we're checking for it more, it's actually that people are getting it more.
That's right.
And that's where we talk a little bit about, and not to get too much into the conspiracy theory side of things, but that's where we talk about, well, we've actually changed wheat.
Yeah,
we fundamentally have changed it. And there's this argument back and forth about, well, it's not genetically modified, it's hybridized, and the immunologists are saying, we're splitting hairs there. No, it's changed fundamentally.
It has.
And just like, we still don't know, you talk about this all the time with the GMO stuff. We don't know what that's doing to us.
That's right. Exactly. We're beginning to get a hint of it.
We're beginning to with a lot of the general problems that we're seeing now.
But gluten actually, just to explain that for the listeners who may not be familiar with that term.
What is gluten?
It is actually the protein component of our cereal grains, primarily the wheat, rye, oats, barley, and then some of the other lesser-known grains like spelt, kamut, and triticale. And it is what provides the protein component for us when we think of grains providing us with some of our protein nutrients. The trouble is, originally, those grains, when you call them the heritage grains, in other words, ones that haven't been hybridized, the original forms, which are still used in Europe, but unfortunately, most of Europe, but unfortunately not in this country, that gluten content went from approximately 3 to 4% of the total content of substances in the grain, to anywhere from 12 to 25%. You know those New York style bagels that you can get? They're grown from a special kind of wheat, only grown in New York if I'm not mistaken, and the content of gluten in that is somewhere between 20 and 25%, which is why those particular type of bagels are very chewy. The thing is, they increase the gluten because that's what gives breads and bread products that chewy, elastic,
it's sticky,
fun stuff. But unfortunately, the gluten has somewhat of an opiate kind of effect on our brains.
That's the part of it that's the gluteomorphin part of it.
Right, and it's on everybody. It's not just people who have a problem with gluten, and it's addictive. And it's the bet you can't eat one.
Yeah, that's why you can't pass up that basket full of bread at the table.
Absolutely.
We have to get into that.
Or you walk past a bakery and suddenly you have a hook that pulls you right in.
That's why any of you that have tried to give up gluten before and say you felt worse, that's called withdrawal. Mm-hmm. That's what it was. And it's not that you were suddenly deficient in some sort of vitamin or mineral. You were going through withdrawal.
That's right. And it's a scary thing. Now, here's another thing we're addicted to. It's not just sugar anymore. Now we've got into the glutens. So, given the fact that so many people have such a problem with gluten, how is it that it causes so much of a problem that we're constantly dealing with, both in our practice and generally, I would say, across the country?
Well, like we said, we're seeing a large increase in people that are allergic to it, essentially. Mm-hmm. And, you know, like we talked about last week on the program, when we talk about allergies, there's lots of different semantics to it. There's different antibodies for it. There's different parts that really make up an allergy or sensitivity. But people that have this intolerance, this immune tolerance toward it in one fashion or another, when you consume it, you're making antibodies against it just like it was any other kind of antigen, just like it was a bacteria or a mold or a fungus or a virus. Your immune system is having a response to it. Mm-hmm. And when we talk about the immune system, we talk about immune responses, we're talking about inflammation. So you're increasing inflammation in the intestinal tract. That's going to wear away at the walls of it, and that's when we come into all sorts of, that is the true kind of celiac disease presentation of it.
Right.
When it is so irritating in the tract that it makes lesions.
It actually damages the lining.
Yeah, it breaks it up. It causes bleeding in there. That is a small percentage, though, of people that have the intolerance to gluten. It's only, I think it's about a third of the time that it actually impacts the tract like that. And even with celiac patients, for every one, there's another 8 that have silent symptoms.
Right.
So It's a very hidden disease. It's not something that's generally looked at. We see it so much in our clinic with people, and we see the absolute amazing turnaround. It never ceases to amaze me. People get off it, and a week later, oh my God, I can tell the difference. I feel so much better.
Exactly.
Without a doubt.
Exactly. And sometimes it can be a remarkable shift in their overall patterns of what you see structurally, and just their sense of well-being, their emotional status, their immune system seems to be strengthening in the presence of a horrible pollen season. It's just unbelievable what happens when people get off.
And because it's such a large portion of our population.
Right.
It's immense.
Dr. Poe, we have a call on line 1. Robert.
Yes.
What can we do for you, sir?
Well, I'm having a problem with losing weight. I'm a little over 6 feet tall, and I've spent most of my adult life weighing between 450 and 500. Mm-hmm. I was about 550 at one point. About 2 years ago, I tripped and fell and tore my left shoulder apart. I had to have surgery, and after getting that fixed, and I have one less limb, I decided, okay, this isn't going to work for me anymore, as little as it had been working for me so far. And I just started losing weight, but I'm diabetic.
Okay.
And I got down, I lost about 80 pounds, and then I started having some diabetic neuropathy, the tingling in the feet, numbness started to, okay, I better start my, I'd been taking my medication mostly, but I said, okay, I better take all of it now. And as soon as I started taking all of my medication, as soon as I started taking all of my medication, I managed to lose about 20 pounds, and now I'm stuck at about 350.
Okay.
And I'm just stuck in a range, and it won't budge. And a doctor I spoke to said, the medications that you're taking, you're not going to be able to lose weight. You could starve yourself and nothing will happen. And I have tried starving myself, where normally that would have...
That's not a good thing either. Okay.
And nothing's happening. I can't budge at it. I'm going to have to either go on Atkins for a while and lower my medication so I can lose weight again, or I got to figure out something. What's going on here?
Well, part of the fact is when you have a diabetic situation, you have a metabolic confounding situation that is going to make it a little more difficult for you to lose weight. And you do have to be a little bit more careful about the choices that you make as far as how you want to do that. Ideally, the best way to go about that is to find someone who can figure out where your best ideal weight should be based on your body fat composition, and also to structure a diet that allows you to have a slow but steady weight loss. Rapid weight loss is usually muscle. It is not fat. The body will not give up its fat readily. And it's even more difficult when you're diabetic and you have to take certain medications that interfere with your ability to break your weight down. One of the best things to do is to find a professional who is competent and familiar with working with diabetics, and let them put you on a good balanced program, not some crazy fad diet out there, because you have other health issues going on, and some of the craziness can create a problem.
And who would that professional maybe be?
It would be a good qualified nutritionist.
Just like you. The problem, what medication are you on? Are you on metformin?
I'm on metformin, 1 gram twice a day, and Januvia. I switched from Axos because I didn't like those commercials I was seeing.
Yeah.
But the metformin, I was only taking the one in the morning, and I wasn't taking any pills at night, so I just didn't take that one at night. And then I finally started taking that one, and that's what froze me in place.
Well, what you have to do is also watch your blood sugar levels and make sure that the balance is where it should be in your diet.
Yeah, it's a multi-step approach. The problem with drugs like metformin is it inhibits the liver's ability to make blood sugar, essentially. And the place where it's going to essentially pull that from is going to be fat. So it makes it very difficult to do a lot of conversion after a certain extent of time. And that's where you start to run into those problems. But anything like, diabetes, any kind of neuropathy, you want to be very careful. You want to get down, because you're having neurological problems now. You've got to get down to the root cause of, well, how did you get diabetic in the first place? You've got to go back and look at all those different factors, because there's lots of different things that go into play. Is it just because you weren't eating the right things, or are there other pieces involved with that as well? And that's a very difficult thing. But, Robert, please feel free, send me an email at Roselle Care. I'd love to talk to you about this a little bit more and see if we can figure out, what's, really what might the root cause be, and get you a plan for that.
Absolutely. And you can also call the office at 703-698-7117. Hi, all. This is Sue Roselle, standing in for Dr. Tom Roselle this afternoon. And my guest today is Dr. Leonard Poe. And before we get back to discussing our topic on gluten intolerance, I wanted to remind all of you about our Ageless Health Seminar that's coming up on October the 20th. And I know you think, October's a long way away, but keep in mind it's May 20th already. The year is flying past. It's going to be at the Fairview Park Marriott Hotel again this year. And currently we are offering an early bird special for registration. The registration fills up very quickly because this is a dynamic day. It's a fact-filled day where you will leave with a tired mind, but full of all kinds of tools and ideas and things that you can do right from the very beginning to help you do a better job along your path of trying to get yourself healthier and more vibrant and full of the kind of life energy that you all want to have. You can save up to 15% today if you go to therosellecare.com or by calling our office at 703-698-7117. That's the Ageless Health Seminar 2012, October 20th at Fairview Park Marriott. Call our office and schedule yourself in. That way you don't find other things you have to do because you don't want to miss the program. It's a dynamic day.
I have to say, and I'm glad that Dr. Tom's not in the country right now to listen, because I'd never want him to hear this, but I'm actually excited about this year's. I wouldn't tell him that, because I got to make him think it's painful that, we got all this work and we got to put together these lectures. But last year was a lot of fun, and it was a lot of great information. And this year, one of the reasons why I'm kind of looking forward to it is because one of our special guests that's going to be there, Dr. Deb Mladenov, is going to be speaking. And this is a guy who was, really one of my first mentors. He's the one that taught me applied kinesiology. He is always a blast to listen to.
Absolutely.
He is so much fun to listen to. You learn a tremendous amount from him. He's got a great perspective on health and life, and he's a wonderful guy. He was the chiropractor for the Kansas City Chiefs for 20 years?
I have no idea. Long
time.
Yeah.
Long time. And he's got some great stories to tell. You'll really enjoy listening to him. You won't want to miss him. Lots and lots of fun. So it'll be a great program this year.
Absolutely. He's got that amazing ability to take a complex information and make it fun and interesting and understandable.
Yeah, he's wonderful to listen to. You won't want to miss him. And they're both together right now in China, actually.
Absolutely.
So I'm sure he'll have fun stuff to bring back and talk about along with Dr. Tom.
I hope so. So with the gluten situation, back to the problem at hand today. Tell me some of the problems that come along when people have a sensitivity. We just have a couple of minutes here, but
I'll tell you,
let's touch on it.
Just in the couple minutes, the first problem that we have is figuring out, do you have a sensitivity? Mm-hmm. Because that's the linchpin that gets a lot of people. I've seen patients go out for that test through LabCorp for the celiac panel, and it almost always comes back negative. And we retest differently. And what I mean by that is we look at different antibodies for it. We look at other parts of wheat besides just that one piece of gliadin, which is the protein in the gluten that they check for on the LabCorp panel. And we see, you do have a gluten allergy, actually.
Right.
And you've been told it was okay and been eating it and been doing more damage. You've got to understand that LabCorp test, it tests for about 2 out of 24 different parts of the wheat that you can be allergic to.
Right.
It is not a complete test. It was the best technology available for, many, many years up till, about a year ago. And now we've got better testing to be able to do that, but it's very incomplete. So if you've had that before in the past, that might not have been very accurate.
Right.
And it might be something that you want to go back and look for. Listen, companies like Bisquick and Betty Crocker and Domino's Pizza do not put money into research and development without knowing that there's going to be some profit on the tail end of this. And that's why we see all these companies now that are coming out with this, because it's not just some weird, strange trend that, these strange people over here are following.
That's right.
It is a real health epidemic. And many, many, many people now are going to this and saying, hey, you know what? Maybe I shouldn't be eating gluten. Maybe this isn't the best thing for me. Maybe it's causing some of my problems. And now we're really starting to see that. So testing and figuring it out is kind of the first big thing.
Absolutely. This is Sue Roselle, and my guest today is Dr. Leonard Poe, and we're talking about the gluten epidemic. Dr. Poe, tell us a little bit about why this is such a problem. What kinds of things is this creating in our society as a overall health problem? Well,
it really is a problem, and I'm not a doomsday kind of guy. I'm real middle of the road. I'm not real esoteric. I mean, I'm very logical and straightforward, and so this isn't just something that's kind of crazy and out there. I mean, this is something that we really do see with patients. Immunology, if you start reading immunological reviews, they're starting to find this stuff. It's starting to pop up all over the place. I mean, this is something that they're really starting to understand is a serious health concern. They see it affecting a lot of people in a lot of hidden ways. Mm-hmm. And that's the tough thing about it. And that's why sometimes it's like pulling teeth to try to get a celiac panel or try to just get some gluten sensitivity panel done because not everybody is symptomatic in the way that we typically think of it.
That's right.
If you have a gluten allergy or a gluten sensitivity, or even if you don't, it's not necessarily going to impact your intestinal tract. It will a lot of times, but not all the time. Like I said, it's only about a third of the time. So you've got a lot of these patients that have things like joint pain, we're going to talk in a minute here about a lot of the neurological disorders that can creep up because of it.
The autoimmunities.
The autoimmunities, and that's really, they're saying that the gluten in itself, and we're going to talk about zonulin in a minute, will cause leaky gut syndrome, and that's really the prerequisite for autoimmunities.
Right.
And we see it in kids. Kids, we see it a tremendous amount of time in. It's amazing. You see these kids that are being diagnosed with ADD and ADHD and all sorts of learning disabilities, and they come into our clinic, and we get them off some of the foods that they're allergic to. Gluten and dairy are two huge offenders.
Too huge.
And then, oh my God, they're like totally different children.
That's right.
They're
not bouncing off the ceiling anymore.
It's amazing to see the difference.
Absolutely. Well, you mentioned that a lot of the autoimmunities begin with a breakdown of the intestinal tract. We call it leaky gut, which is a fairly good descriptive term of what it is. Basically, what happens is with the gluten particularly, but it can happen with any of the food allergies if they're true allergies, when they are encountered in the intestinal tract, they trigger an enzyme to be produced called zonulin. And what that enzyme does is it controls intestinal permeability. In other words, it actually creates microscopic little breaks between the cells that form the lining of the intestinal tract. Well, you've lost a major protection against substances getting into the body and activating the immune system. And very often, gluten sensitivities, particularly in the non-celiac disease people, is where the problems of their health all begin.
But today, too, not even if you're sensitive to it or not.
Right.
It's because of the way we've changed the wheat.
Changed how it is.
That it actually is increasing the zonulin production even more so than ever before.
And the people that we see, of course, have already gotten significant loss in their gut integrity. So stuff gets through, and it's not just now allergic to gluten and the grains that contain gluten, but it's all kinds of things that they eat a lot of. It can be chicken and spinach and cucumbers and tomatoes and all kinds of different things because the integrity of the intestinal tract has been breached.
That's a direct barrier system in the body. That's like having your skin cut open.
That's right.
It's the same kind of idea. Now you're allowing things to get inside of the body.
That shouldn't be. But zonulin doesn't just affect the gut.
No, and the other problem that we have with that is it affects the membrane, we call it the blood-brain barrier, but the membrane that protects the brain. Mm-hmm. That is a very, very tightly guarded barrier system that protects your brain. Very few things are allowed in, only very, very small things. It's extremely selective because there's really no immune system working in there. It's different than the rest of the body. So the body takes special precautions to protect it, essentially.
Right.
And when that membrane starts to break down, that's really the segue into lots of the neurological disorders that we see, lots of the neurological degenerative orders that we see. And studies are starting to link things like Alzheimer's and Parkinson's. I've seen clinical presentations for ALS, which is Lou Gehrig's disease, which is just one of the most horrible diseases that
Absolutely.
You can have. It's terrible. When they start linking diseases like that to gluten and the breakdown of the blood-brain barrier, you got to step back and really think about that. Is it really worth eating bread at that point?
That's right.
If that increases that kind of possibility, especially if you understand. If you don't know what ALS, or also known as Lou Gehrig's disease, is, go look it up, and you'll be absolutely horrified.
It's horrible.
But you look at the number of people that we see today that have things like Alzheimer's and Parkinson's. We see a lot of neurological degenerative diseases now.
That's right.
And they're increasing.
And at younger ages. But it's not just the diseases. I mean, the anxiety problems that people have, the
all sorts of neurochemical imbalances, yeah.
There actually creates damage and inflammation to the front part of the brain, which is what creates a difference between humans and every other animal species on the planet. That's our ability to remember, to create, to think, to solve problems, to have a short-term memory. So it's far-reaching. Even if you don't have one of these horrible debilitating diseases, it still can be greatly disruptive to your overall ability to function at your workplace and your life. And this even goes beyond just the digestive discomforts that come when people have a gluten sensitivity.
Yeah. How many of you walk in rooms and say, "Why am I here?" I came here to do something.
Where are my keys?
What am I doing? And then you go back to where you were about 10 minutes later, like, oh, yeah, I meant to do that.
Yeah, exactly.
Yeah, that brain fog.
It's the brain fog and the digestive stuff, the things that just make your life kind of less than comfortable, less than perfect. You eat something that you think is a good meal and you end up with bloating and you end up with gas, or you have constipation or diarrhea problems, or you have severe pain. You have a nice meal and then you look down and you've got a belly that you have to open your pants because you can't stand the pressure. These are all symptoms of not the horrendous, debilitating diseases, but of the everyday annoyances that we all have to face many times.
And it's those everyday annoyances that's the snowball that's slowly building. If your gut is not processing and digesting, and you're not getting the nutrients you need, guess what? You're getting breakdown in lots of other areas of the body.
Absolutely.
I mean, this is like, a construction site. And if you're not getting materials delivered, you're not really building things. You're not making new tissue. You're not healing. You're not making enzymes. You're not making hormones. You're not making neurotransmitters. You've got systemic problems across the board. And that's why we see people come in. It's not one single thing. It's so many different aspects of their anatomy and physiology that are being dampened here and hindered that they are where they are.
And guess what? That's called aging. When you can't replace the cells that are worn out with cells of equal quality, you get aging.
That's why we always talk about that. We use that term ageless health. It's that your health can really be ageless if you're doing the right things and you're keeping that physiology working well.
And you're keeping things out that are causing your body to have all kinds of difficulties. The body's amazing in its ability to adapt and to correct and to get around and somehow manage to survive all kinds of incredible situations. But if you want to maximize the overall health of the body, we have to start looking at the things that cause it to start breaking down and eliminate these things that tear down. One of the things that makes hard with the gluten sensitivity, though, is the fact that not only can gluten be a problem, but it has a substance called cross-reactivity to other substances. And these may be other, quote, non-gluten grains like corn and buckwheat and oat, but it also can be in dairy products, primarily the protein called casein.
This is why it's really important to figure out as soon as possible, do you have an allergy to it or not? Bottom line is you shouldn't eat it, but do you have an allergy or not?
Right.
Because if you do have an allergy to it and you're making those antibodies towards gluten, there's a good chance that the immune system can get a little bit confused. It happens. And that it will start looking to attack other things that are cross-reactive, like Sue just said, that look a lot like gluten. It looks, at the protein level, it looks very similar. And then once it makes those antibodies towards that substance, well, now you've got a second allergy.
Absolutely.
And it's really, and then we can't just have wheat, but now we can't have corn either.
And we can't have dairy.
So that's why it's so important to check and really see, is this a problem? Because if you let it continue on, that's when you start to pick up multiple allergy patterns, and then it really starts limiting the things you can eat and the things you can't.
I think we're discouraging people. I think they're getting scared.
No, just stop eating it. You'll be better. Well, it's easy now too. Okay, you talked to a celiac patient 20 years ago, and it was...
And they struggled.
I mean, It was near impossible to go out and find anything.
Right.
You've got so many options today. I mean, it's ridiculous. Once you go out there, and I talk to patients about this all the time. I mean, I'm sure you do too. Mm-hmm. They're always surprised. Yeah, there's a lot out there.
There's a lot out there.
There's so many choices.
Absolutely.
Now, the problems with some of those choices, and here's where you need to balance it some.
Right.
And you just need to be cautious, but it's a very easy process to go through with a little bit of help.
It is, because the information is getting out there and people are starting to really get serious about this. A lot of the companies have gone into making their versions of gluten-free products that are available across the board, and almost every grocery store has some. The interesting thing and the important thing is we now have some watchdog groups out there that are making sure that as they are creating these gluten-free substances and packaged products, that they are truly gluten-free. So that's good. You don't have the possibility of contamination from sort of gluten-free products. The only trouble is that we're back to white bread stuff.
Yeah. White rice, tapioca.
Most of the products that are in the gluten-free products are inferior as far as nutrient value goes. They're low in fiber, they're low in nutrients, they're very highly processed. And so where years ago we may have talked about eating a lot of good quality whole grains and so forth for the best health, now we're talking gluten substitutions, which are basically white bread, fluffy, that white, devoid of nutrient value.
It's to get your fix.
It's to get your fix.
It's not to support you nutritionally.
Absolutely.
The great gluten-free products are things like apples,
yes,
and cucumbers,
things that don't come with a label.
Right. But they allow you to get your fix.
We have a call online. Sarah?
Hello?
Hello, Sarah?
Yes, this is Sarah.
Hi. What can we do for you?
All right. I've recently been diagnosed with colitis. I had a lot of cramps and went to the hospital, and that's where the diagnosis was made. And listening to you, I'm almost convinced it's from gluten. But I am very careful what I put in my mouth, right, and what I eat. And I try to look at every label. If it's got too much salt in it, over 150, I heard your husband say, I don't buy it, all right? I just put it back on the shelf. But some of these labels are written so small that you have to have a
magnifying glass, I know.
glass with you. And just as I'm talking to you, I'm looking at this bread that I bought. It's called olive bread, okay? I don't see gluten in there. It says unbleached wheat flour.
There you go.
That's gluten.
Right there.
Is that it?
First ingredient.
Anytime it says wheat.
That's the gluten?
Yes, ma'am. Certainly
it doesn't
is.
say gluten.
Of course not. That's for you to figure that out. That's why we do these programs.
Listening to you, they're hiding it from us.
Well, wheat, rye, barley, spelt, kamut, and triticale, and oats to some degree all have gluten in them. So if you have a product that has any of those grains in there, you are getting gluten. And that's the obvious. And then they have the gluten that's hidden in things like soy sauce and processed packaged products that have MSG, that have the meat substitutions in veggie patties.
Any of the meat glues, things like that.
Any of those kinds of things. So you get gluten in lots of places you wouldn't even expect to find it.
And just because it says wheat-free doesn't mean gluten-free.
So, Sarah, yes, you very possibly could have trouble with the gluten. It's something that could be explored. If we can be of any help to you, please contact us. Hi, this is Sue Roselle again, and I'm sitting here with Dr. Leonard Poe, and we are on the air with a lady. Sarah, are you still there?
I'm still here.
Okay, very briefly, I wanted to say before we had to break, if you need to get in touch with us, you can always contact us at www.rosellecare.com. And you can also call our office at 703-698-7117. It is very possible that your colitis at least is being aggravated by gluten, and it may be something that's been working on you for years.
What's your second question, Sarah?
All right. I've had some terrific pains. It came on suddenly in my knees, all right? And where I couldn't even bend my left knee, I had to eat sitting up. The pain was excruciating if I sat down and tried to get up again, all right? I just wondered if, and I don't have problems like that. And this came all of a sudden. And as I said earlier, I don't eat much bread, but I did buy this bread I was talking about with the unbleached wheat flour, and it's called olive bread. And I just noticed, too, after I did get a magnifying glass out, it says here, consumers with allergies, please read the ingredient statements very carefully.
It does. Okay, it's a possibility that maybe the knee pain has something to do with this as well.
Well, it could be, obviously, with something like colitis, where we've got lots of inflammation in the intestinal tract. You're going to start to have problems with systemic inflammation everywhere. Obviously, you want to rule out any kind of traumas, any kind of blood clots, things like that. But we often see patients that have lots of diffuse types of joint pain with any kind of inflammatory digestional disorder like that. So it would not surprise me in the least, but that's something that you can certainly get some help with. The first part is cleaning up the intestinal tract.
Okay, Sarah, get in touch with us if we can give you some more help. We're going to have to scoot here. There was something that I did want to make sure that people understand, that it's a difficult problem to take care of. But there are a number of good websites out on the internet that would give some good information. One is www.conquergluten.com. And Dr. Poe, I think you have one too.
Yeah, there's another really good one called glutensensitivity.net. It talks about it from a couple different angles.
You get a lot of good basic information that can at least get you started on the path of determining whether or not there's a problem for you, and maybe that is explaining some of these nebulous health issues that you've got that just don't seem to want to get taken care of. They just don't want to clear up. Again, I just wanted to remind you all that if you would like to listen to this program again, you can go to RoselleRadio.com and listen to not only this one, but I believe the last 4 that have been broadcast. And don't forget to visit us and register for Ageless Health 2012 at RoselleCare.com. Nice to talk with everybody. Nice to have you, Dr. Poe.
I'll be on the radio program again next week with Dr. Pina. We're going to talk about autoimmune disease and all the different types that go on with that. And it's really a segue off of this program with gluten allergies and gut permeability. So I hope to have you join us then.
Thanks
Everybody
a lot.
Take care.
This is Sue Roselle. Bye.